This is Martha. She's 13 months old. She's come into hospital with an abscess in her right armpit or axilla. Martha is HIV positive, but her medical history shows it took a long time for this to be diagnosed. Martha's mother tested HIV negative while she was pregnant. Because of this, Martha did not have any treatment to prevent mother-to-child transmission and was not given nevirapine syrup, nor was she noted in her health records as an exposed baby at birth. In Martha's battered health passport there's a good record of her first year, in part because she's so often been sick. Her height and weight were measured at regular intervals, but the growth chart was only filled out for the first 4 months. It shows very good growth for 3 months, where she reaches a weight of 8 kilos, and then the entries stop. This is what her first 9 months of growth would have looked like if the chart had been filled out each time Martha was weighed. Martha's illness started soon after she began to lose weight, with oral sores and a cough. At 6 months, after a week on antibiotics for a cough and fever, she developed pneumonia and respiratory distress. Semi-conscious, she was transferred as an emergency to the central hospital. She was admitted for 10 days. She was reviewed by the ART clinic at discharge. At this point, Martha's mother tested HIV reactive. A DNA PCR test was taken from Martha. The result usually takes a month to 6 weeks to come back. Shortly after, Martha's father also tested reactive. He started cotrimoxazole and had a CD4 count done to see if he needed to start ART. Martha's siblings tested HIV negative. 3 weeks later, while Martha was waiting for the DNA PCR result, she was taken back as an emergency to the hospital with very severe pneumonia and oral candidiasis. On admission, the clinician noted Martha was waiting for a DNA PCR result and wrote down presumed severe HIV disease and suggested that she was eligible to start ART. Martha was not started on ART. Instead, she spent 8 days in hospital before being discharged with a follow-up date made for 2 weeks later. By now, she'd had a cough and oral sores for more than 5 months. 2 weeks later, Martha's DNA PCR result came back positive. She was finally initiated on ART. In the months following initiation on ART, Martha continued to be acutely sick. She was again admitted to the central hospital with severe malnutrition and edema and put into a feeding program. She had another bout of severe pneumonia. Her weight started to increase, but only very slowly. Her upper arm measurement was now 11 centimetres. Four days ago, Martha was brought into the clinic with an abscess and swelling on her right armpit. Her mother says this started not long after starting ART, but has now got much worse. The swelling is filled with pus and it's painful. This is the arm where she was given a BCG after birth. She has no fever, night sweats or respiratory distress, but she does have swollen glands and her chest sounds noisy and she has a cough. She also has white oral sores. She looks thin. The nutritional assessment shows Martha to be gaining weight slowly but still severely malnourished. Most worrying, her upper arm measurement is now 10.5 centimetres, less than 2 months ago when it was 11. This is her X-ray. She's too young to do a sputum test. Martha is started on TB treatment. She'll stay in hospital for the first few weeks to monitor this and also monitor progress of the abscess in her armpit. The oral thrush is treated. An X-ray is also made of her mother, but this turns out to be non-suspective for TB. After 2 weeks in hospital, Martha appears to be tolerating the TB treatment well. The swelling in her armpit still looks extensive. However, the abscess is no longer hard and can be moved around. It's judged to be healing. As she's improving well, Martha and her mother are discharged from the hospital.